of background within the newly rebranded Graduate School of Healthcare Management at the Royal College of Surgeons. So we rank within among the top 2% in Times Higher Education World University Rankings. And one, we've been developing leaders in healthcare management for over 220 years. And we're also known for empowering women in leadership, accredited internationally by the National University of Ireland. And as you can see, some of our resources listed here. We have a 2-week online orientation within the Graduate School of Healthcare Management, a reference guide, an EndNote bibliographic reference manager, academic writing and support, which is very important when you're being assigned your module courses. We also have group writing support sessions, recommended reading lists, and a Grammarly subscription. So we have an abundance of resources for all our prospective students to help you along the way. And you'll just see here, this is our global footprint within the world. So as you can see, we have alumni from all over the world, from South America to Ireland, Europe, and as far as Australia, and particularly in the Middle East. And I know a lot of people joining from the Middle East today, and we are delighted to see you. We have over 2,000 alumni within the college, and we're very proud of them. So before we get started, I'm going to hand you over to Sarah McDonald now, who's going to give you an official introduction to the webinar. So Sarah, thank you very much for joining us.
Thank you very much, Amy, and I'm delighted to be here this afternoon. My name is Sarah McDonald, and I am Executive Director of the RCSI Graduate School of Healthcare Management. The Graduate School is part of the RCSI University of Medicine and Health Sciences based in Dublin, Ireland. Founded as, I suppose, the Royal College of Surgeons in Ireland in 1784, today we are Ireland's only singularly focused health sciences university. RCSI as an institution, as Amy mentioned, has shaped healthcare and trained leaders in health since its inception. And as a constituent school, the RCSI Graduate School of Healthcare Management specialises in understanding and improving the management, leadership and organisation of healthcare. My role as Executive Director is to ensure that the team we have assembled and the structures we have in place deliver the very best in healthcare management insight and learning, while offering a supported and scaffolded student experience. This includes strong academic leadership and governance, expert faculty, and a specialist operations team, all working together to create an environment that supports learning, knowledge exchange, engagement, and collaboration. We are here to help you access and utilise cutting-edge management theory so that you can transform healthcare, improve patient care, and shape your own career path. At the Graduate School of Healthcare Management, we leverage the best of digital design, development, and delivery. Our model supports the needs of the learner by offering a portfolio of programs relevant to the breadth of healthcare. Our programs are created and delivered by faculty who are experts in the areas they teach. They in turn are supported by adjunct faculty members and guest speakers with real-life experience of leading major healthcare organisations and tackling the challenges that come with complexity and change. The research conducted by our team is directed at tackling grand challenges and complex problems that cut across disciplinary, organisational, sectoral and national boundaries. This calls us to engage with topics such as healthcare innovation, quality improvement, patient safety, leadership, entrepreneurship, healthcare management, collaboration, systems thinking, digital disruption, human resource management, ethics, empowerment, justice, and well-being, to name but a few. All these elements provide an unrivaled educational experience. be that on our master's programs in areas such as leadership and innovation, healthcare management, and quality and safety in healthcare, or on our professional diploma in clinical leadership and our programs in human resource and performance management and leading quality and value improvement. These programs are specifically designed for clinicians, managers, healthcare professionals, and those in the allied healthcare sector, looking to expand their own knowledge and skill set, advance their organizations, and take the next step in their career. Our programs create opportunities and options for learners. At the Graduate School of Healthcare Management, we also specialise in working with healthcare organisations and systems in Ireland and internationally, delivering executive learning and tailored solutions to organisation challenges. Here at the Graduate School of Healthcare Management, we understand both the fulfilment and the challenges of learning alongside career and life commitments. Our team are here to guide and support. Our expert operations team have designed systems, structures, and interventions that guide you through your learning journey and make this navigation as seamless as possible. We recognise prior learning, we provide support if you've not studied for a while, and we ensure that there is effective feedback designed to help you reflect and grow. As an internationally focused graduate school, we are excited about the possibilities that exist to shape healthcare across the globe. We are developing new programs and new modes of delivery that meet the needs of healthcare professionals in an ever-changing healthcare landscape. COVID-19 has shown us that we must be prepared for anything and equipped to support healthcare provision and patient care in both ordinary and extraordinary times. Together, we can work to lead better health by creating a global network of exchange and learning. Again, I would very much like to welcome you to our webinar this afternoon, delivered by one of our most trusted members of our adjunct faculty. Paul Edouard is a core member of the delivery team for our professional diploma in clinical leadership. He is an experienced dental surgeon, an alumnus of the Graduate School of Healthcare Management, and an accomplished raconteur. So without further ado, I will hand you over to Paul, who will talk to you this afternoon. Thanks a million, and thank you all for being here.
Thanks very much, Sarah, and I'm sure that yes, the raconteur thing I like at the end. Very good, and welcome all. I'm live here for the first time in a very long time, actually from York Street, which is one of our buildings here in St. Stephen's Green at the Royal College of Surgeons in Ireland here in Dublin. And as you can see from the biography, my background is of course general dental practice, and I, as was mentioned, have a master's degree from healthcare management here from the RCSI. The reason I'm giving today's talk on finance, it's one of those topics that often slips through the radar. People don't like to talk about. I've had a lot of experience with this, not just running my own practice, but also in my position formerly as National Clinical Director with Ireland's first ever dental corporate. So I was involved with helping to manage 26 clinics throughout the Republic of Ireland. From that, and informed by a lot of the dentistry that I see throughout the country, I was seconded on to one of the panels involved with shaping national policy with the Department of Health, with the recent unveiling of the oral health policy, which was launched in 2019. And as if studying was never too far from my thoughts, I'm also back doing a PhD part-time with the SPHERE program, which is Structured Population Health. So again, it's one of those things that I like to do. It keeps me off the streets. I'd like to welcome everybody from around the world who is joining us today. Amy is with me in the background, and Amy, you might slap on the first slide just to get our talk rolling, as they say. Thank you. So we're going to take a look. Thank you. Yes, this is the one I'm looking for. We're going to take a look at the vaccination program. Now, I know that there are many of you joining from Ireland, but from further afield. And when COVID-19 hit, of course, we were at a loss as to what our responses would be. And one of the most popular phrases, which was bandied about by many in the medical fraternity and beyond, was this old chestnut: salus populi est suprema lex. It's always great to start a lecture with a bit of Latin. It makes you sound more intelligent than you are. That's what I often say. So the classical scholars amongst you will recognize in the right-hand corner our good friend Cicero from ancient Rome. And this is a phrase, of course, which holds much weight for today, as much as it did in ancient Rome, which, of course, is that the health of the people, or the welfare of the people, is indeed the highest law. And this was something that, of course, was foremost in our minds when COVID-19 hit. And many of you who are on front line will understand the enormity of the challenges that we faced. And part of the dealing with this, of course, wasn't just getting to the patients when they were sick, preventing the spread of disease, containing the COVID outbreaks as they occurred, but also understanding the logistics of how we would do this. And at the very heart of how we actually respond to these things is the financial infrastructure, the paying out of the various costs involved to make sure that the right people get the right care at the right time. So let's move on to the next slide, please, if we can. So today's talk, as I say, is about finance. Now, one of the key things that we particularly tackle in the healthcare management masters and indeed in the diploma in clinical leadership is a thing called health finances. Sometimes this is confused with the term health economics. Now, if you're like me and you're just a regular, what I call drill, fill, and bill merchant, in my old days as in general practice, these are two very lofty terms. And again, if you're a clinician, boots on the ground like me, I like to understand in simple terms what they mean and what's the difference between the two. So let's pop on to the next slide. I'm going to give you what the WHO tells us about finance. So healthcare finance, according to the World Health Organization, refers to a function of a health system concerned with the mobilization, accumulation, and allocation of money to cover the health needs of the people, individually and collectively, in the health system. And the purpose of health financing is, of course, to make funding available, as well as to set the right financial incentives and to provide that key framework or mechanism, if you like, for personal health. That's the World Health Organization's definition. It's a very long one. It's quite involved, but basically boiled down into a nutshell, it can be basically how much do things cost. Finance is really designed around the cost per item of each service that we provide for our healthcare. So we flip on to the next slide, please, Amy. Economics, on the other hand, can be thought of as efficiency, as effectiveness, as getting value and understanding the behavior in the production and consumption of indeed healthcare itself. So we can see that finance itself is part of that bigger picture. So if you like, finance is how much is it going to cost, and economics is has it been value for money. And the reason I talk about those two things is because they are inextricably linked. One of the other things that we talk about in finance, and particularly for clinicians who are listening in today, is when we're trained in whatever discipline, it can be medicine, it can be dentistry, physiotherapy, whatever it may be, we leave university with a really good grasp of how we approach our patients and provide clinical training and clinical service. But unfortunately, very few of us really know what an overhead is. Two of the ladies listening in today, Anna and Emer, were just on with me at a webinar which I was delivering for the financial package for the Diploma in Clinical Leadership. And we talked at length about overheads and costs. And these are kind of alien terms to us, which we grapple with across the programs here at the Graduate School of Healthcare Management. And I'm going to talk about one particular aspect, as I said, vaccination, which I think has really struck a chord with all of us, and here particularly in the Republic of Ireland has been successful. So we might move on to the next slide, please, if we could. So the national vaccination program was very big and is very big. It's still rolling here as we speak. There are many aspects to it, from, for example, the supply chain, the sourcing of the vaccine, the organizing for its distribution, its storage, and then indeed understanding how we can actually disseminate this vaccine, get it out into all of the arms and shoulders across the nation. In this particular population, we're talking of just under 5 million people. So it was a very ambitious plan, and there were very many moving parts to it. Specifically, I'm looking at one particular part of one particular aspect, as we'll see. And again, as I'm talking about this, and this is what I call the grandiose or balcony view of finance, I'll also be talking about what I call a boots on the ground or foxhole look as well. So we'll just move on to the next slide, please, Amy, again. So this was a very big structure. And for those of you who are policy nerds like me, you can read the entire version of this in the National COVID-19 Vaccination Work Programme. So we can see that there were indeed very many aspects to it. From each of course of these work outputs had a senior responsible officer, an SRO, dealing with the many aspects of this particular program, such as, of course, governance, or indeed vaccine supply, or indeed the vaccine protocol, or indeed the support mechanism supply, and indeed workforce around that. So for each of those particular streams, they must work collectively. And whilst I won't be addressing each of those particular streams, rest assured that there's quite a bit of knowledge behind it that you can look at yourself. Let's take a look at some of the financial aspects behind it. If we can move on to the next slide, please. So when we think about a plan, there's obviously going to be a cost for each aspect. So there can be a high level cost. For example, this pharmaceutical supply agreement, which is where a country negotiates on a corporate or national level with a particular pharmaceutical supplier. And we knew from last October, November, the good news, of course, that both AstraZeneca and Pfizer had vaccines to hand, and these were ready to be deployed. Then you'll have a medium term or medium level nationwide financial cost, which, for example, would be securing sites for vaccination. So in this case, here in the Republic of Ireland, we had secured lots of different sites, mainly hotels. In some cases, they were stadia, but the one I'm most familiar with is a hotel, which I'll talk about in just a moment. And then we have what I call a low-level service agreement, which will be looking at quite a big financial purchase, but small in the very broad scheme of things, which would be things like disposable items, gloves, PPE, swabs, steri-strips, all of those kinds of things, cotton wool balls. And again, each of those has a financial cost. And the reason I mention all of those things is when you go about your daily practical life, be it in practice or in clerical work, you've got to understand that for everything that you do, there is a cost associated with it, even including your time. And I'll get to that in just a moment. But I'll take a little look at each of these three levels and then zero in on one particular aspect that we'd like to see. We might move on to the next slide, please, if we could. So one of the key costs when this whole vaccination program was being looked at, government had quite rightly decided that they had the vaccine supply, they had the chain of distribution, they had access to their sites, but who indeed was going to be vaccinating, or who were the people who were going to be distributing this vaccine? So the obvious solution here was to look at people who were well practiced in vaccination administration. These would be people like, for example, our general medical practitioners and indeed our pharmacists. But of course, these are very busy practitioners as is. And whilst they do understand and actually deliver these things on a regular basis, there also had to be, if you like, adjunct faculty here, like at the GSM, other people on board who had the training, the knowledge, the skill, and the wherewithal to deliver vaccines as well. And so began a HR campaign to employ vaccinators who may not regularly be considered vaccinators. And in costing that, and here's where the finance bit comes into it, the Department of Finance with the Department of Health secured a contract with the GPs and the pharmacists. And the cost at the time, which I think is still right, is €30 for delivering the two-shot vaccines. So it's about €15 per injection given. At the same time, they hired an army of vaccinators. Some of them were actually Army from Defence Forces. Others were colleagues of mine from emergency medical technicians, ambulance crew, nursing staff, former nurses, former GPs, and indeed the occasional dentist. So again, these were all vaccinators. And again, these were employed on contract with the maximum salary being €25 an hour. Now, on the face of it, if we look at how this actually rolls out, having been in the job, as you'll see in just a minute, I signed up like many people to put my shoulder to the national wheel. So I was working in a vaccination booth, boots on the ground, as I like to call it, in a vaccination hub in North Tipperary. And during my time, we were processing through, with 15 vaccinators, 1,000 patients, or clients as they call them in community, per day. From a 12-hour shift from 8 in the morning until 8 in the evening. And at top speed, when it was very, very busy, safely we could probably administer 5 vaccines an hour, which when you were paying your vaccinator €25, that's about €5 a shot. Our GP colleagues, it was €15 a shot. Now you might say, hang on a minute, there's a discrepancy there. But here's where the finance bit kicks in. If we want to just move on to the next slide, please, Amy. Thanks. So we've got to think about what are the financial costs involved. And here comes our famous phrase again, our famous word, overhead. So remember, the GP and the pharmacist is actually providing not just the physical administration of the vaccine itself, they're also providing the actual facility, the chair in which the patient sits, the light in which they're able to administer the vaccine, their own indemnity, their own insurance, their own staff. Importantly, their clinical waste as well, which is not insignificant. They're also providing their own IT infrastructure. They're providing a lot of the support scaffolding around the delivery of that shot, which they're absorbing. Hence, the fee is higher. Whereas in the hub, the vaccinator who's there is just concerned with being there to provide the vaccine and do the IT follow-up. But remember, there's no direct operational cost to them. So that's important. It's creating that line of understanding how we can funnel the correct volume of patients to the correct cost base to get the maximum effect that's going on. And this goes to the absolute heart of where the finance comes in a vaccine rollout of this particular size. So remember, government is outlaying all of the, if you like, auxiliary services to support around each individual vaccinator whose sole job is vaccinating the people as they come in. If we could move on to the next slide, please, Amy. Thank you. So what does this all mean on the ground? So here we go. This is me on the left-hand side and a very happy recipient, and I have the permission to take this photograph in a vaccinator hub. So this is quite interesting because normally I'm in my position where I am right now on the balcony, as I call it, talking at length about healthcare management from the balance sheet view, but from a clinician's perspective. So I found this incredibly interesting to be back down on the factory floor, if you like, delivering vaccines and seeing how the theory of financial management and logistics works on the ground. So if we flip on to the next slide again, Amy. So during my time there, this is the kind of thing that we're seeing. So each individual booth or hub within the hub itself had a lot of these products, which you can see. So for example, we have our yellow bin. And again, one of the things that is a cost, which we may not think about, is clinical waste, which I'm sure many of you who are clinicians will understand is quite an expensive item. So a lot of these yellow bins will fill very, very quickly as we're going through shot after shot after shot. Our cotton wool balls, as we know, to cover over if there's a wound after the injection, unlikely. We also have, of course, our sterilizing solution to wash our hands with, our Steri-strips to clean down between patients, our tape, and indeed our sterile wipes for the vials themselves. On the right-hand side is just a quick snapshot of some of the stores that we had. So again, our disposables such as gloves, you can see our 1 milliliter injections. And then on the left-hand side, we have, of course, our famous COVID badges and some of the IT paperwork that's involved. So again, these are all specific costs that are involved with the rollout of a vaccination program. And again, you might say, how can I apply this to my own organization? So if you think about, just for one moment, the service that you yourself provide, think about the costs involved. I'm fortunate and privileged to look after a number of master's students in year 2 on the healthcare management master's program. In that year, we're particularly involved with understanding how quality improvement works. And as I've just said a little earlier this afternoon, to understand better how to get a quality improvement mechanism through or protocol through, our job as clinicians is to improve the quality of the patient. And we think that that's a good KPI or key productivity index to measure things by, and it is. However, as one of the healthcare provider chief executives here will say, no money, no mission. So if we can't keep costs low and generate profit to fund that, there is no mission. So no money, no mission. So putting those two things together and understanding how they work, that's key and that's crucial. So when you've got a quality improvement protocol, and this is probably one of the biggest ones, if not the biggest one in the country, you've got to understand that there is a cost involved, but translating that into financial terms, being able to explain it with the clinician's eye, but wearing a management finance hat is key. And these are the kinds of skills that we go through in the postgraduate courses that we do here at the RCSI. We might flick on to the next slide, please, Amy, if we could. So these are two very important questions that we have to answer. When we have accredited our costs, created our rollout, trained our team, seen our patients, and hopefully got a good result, as we'll see in just a minute, has this strategy work? That idea of the PDSA cycle, so plan, do, see, act, and then review. Is what we're doing working? What future costs do you think will be required to either sustain that or, importantly, to improve it? And are we learning from this event? Are we learning each time as we create these new opportunities using this financial cost behind? And then the economics question, is this value for money? Is this something that is actually generating a worthwhile cost for a population? So we've gone from, as I said earlier, from the very first slide, that the health of the people is the highest law, to understanding how some of the mechanisms behind the financial costs in rolling out a vaccination plan of this nature, to then putting it down to boots on the ground as a vaccinator, like I certainly am at the weekend still, and jabbing shots in arms, understanding the resources behind it, what is needed to support around that. So again, you as clinicians, wherever you are in the world and whatever you're doing, will better understand the very basics of what we need. So everything from gloves, PPEs, masks, all the way through a good functioning IT system, very good aftercare, locations in which to have your patients, a good throughput of patients from beginning to end, good reception staff, very good IT system, which makes sure everything is ticked properly as we go through. Next slide again there, please, Amy. And yes, the proof of the pudding is in the eating. This is about 5 days old. This is the vaccination percentage uptake on a 14-day incidence per 100,000 of the population. So we can see that in any measure, we're at about 90% or thereabouts, which our scientists are telling us is close to this supposed herd immunity. So again, it's the small parts. It's that individual vaccinator in that individual booth, in that individual hub, which is part of this collective rollout, worked in tandem with our GPs and our pharmacy colleagues in these what are called vaccination administration locations, or VALs, and putting that collectively together has been a success from a clinical perspective. But remember, our talk here today is financial. So does it make financial sense? So when we pare down the figures between those that are vaccinated in these VALs, we have a significant percentage of pharmacies and GPs and a significant percentage of our hubs. One other thing that's often lost off the balance sheet, which we as clinicians will remember, is that relationship that GPs and pharmacists have with their own patients. There will be many patients out there and many members of the public who may be a little bit reticent about coming into an anonymous hotel or an anonymous stadium. So they may well want to come to their local pharmacist. They're tried and trusted. My own parents are in their 80s. They wouldn't dream of going to a vaccination hub. They'll go to their GP, which is exactly what they did. So it's not losing sight of that clinical focus, but understanding the financial costs that come around that, that gives, if you like, a realpolitik of what is, as I say, probably the biggest single measure in this country's history. But again, boiling that down and applying it to your own situation. We might move on to the next slide, Amy, if we could. So how can I apply this to my own practice, my own workplace, or indeed my own organization? So you've got to sit down and ask yourself questions. And if you're like me, you'll have the yellow sheets ready. In your daily workflow, think about the costs that you're incurring. Think about things like, how much does this cost me, and how much is it worth to me? One of the key things, and again, for those of you who work in a hospital environment, may well come across the fallacy of changing gloves, suppliers, I should say. Changing gloves is a good thing. Changing glove suppliers. Sometimes when financial people look at a balance sheet, they find that disposables are the biggest, one of the biggest key expenditures, and they try and see maybe we can cut a corner by getting cheaper gloves. If you've had that experience, and many of you had, it's a common recurring theme we hear in the classes here at RCSI. You'll find that when you put on the gloves, they'll tear and you use a second pair. So you're using twice as much volume, so you're not making much saving. But I want you to apply that to other things. For example, your service level agreements for simple things like your IT provider, your phone provider, your indemnity, your insurance for your building, your other disposables for bandages, if that's something, if you're involved with procurement. So when's the last time that you did a service level agreement review? And even aside from healthcare, how about your own household budget? When's the last time you changed household provider for your phone or your mobile phone, your car insurance? It's no different in private life as it is to work. So these is the sorts of things that we kind of tease out and tease down in worked examples across the programs, both in clinical leadership and indeed in healthcare management, as indeed Anna and Emer will tell you from my earlier talk today. And next slide, please. So without further ado, that's a whistle-stop tour through a very large vaccination program here in the Republic of Ireland. I'm sure experiences worldwide will be similar, and indeed I would be delighted to answer questions or indeed talk about the challenges that face us all in this particular pandemic. Thank you so much for your attention, and indeed I look forward to hopefully seeing you in person or online at one of our programs in the not too distant future.
Thank you so much, Paul. That was excellent, very insightful, and really interesting. Some great tips there. Loving your line, boots on the ground. I think I might have to steal that in the future. I haven't heard that one in a while. So we'll just open the floor up to people there if we have any questions. We'd be delighted to hear them. So if anyone has any questions, please put up your hand, or if you want to put on your microphone or your camera. I have a question anyway, Paul, and I'm not sure if you'll be able to answer it, but anyway, just in terms of, you know, budget and contingency, etc. In Ireland anyway, and I'm sure in other countries, PPE gear failed us on some occasions. Like, what were the lessons learned from that in terms of planning for budget, and would you have any insight into that?
Yes, and that's an excellent question. Thank you, Amy. Those of you listening, I'm sure would echo this as well. We ran into a significant problem from the very early days in March of 2020, and it was actually three different problems. Number one was that the main producer of PPE for us was actually in China, which at the time was undergoing lockdown from the start in Wuhan. That was the first thing. The second thing then was air travel was also a big issue, and then the third thing was just volume supply. So the lessons learned really were, in certain respects, we need to start producing our own PPE here. That was the kind of bigger overall pictures, if that's something we can do. The second thing was, of course, stockpiling. Now, there is a kind of a shelf life on certain PPE items, so that isn't always an issue. But the lessons we have learned was to absolutely make sure we have a distribution chain in place, that it's reviewed regularly, that quality assurance is put in place, and finally that we have the ability to store and to stock within reason. So there is future planning in that. That's something I think that would probably be brought on board with what I hope is going to be the new pandemic alert team that's being mooted at the moment in government. But great question to ask.
Great. And sorry, just another one on that. In terms of now, we're talking about, you know, a booster rollout for the vaccination program. Would that have been factored in to the initial budget, or is this just something that's been added on as we're making our way through the pandemic crisis?
That's that again, a really good question to ask. All the chat at the moment is at boosters. I think it falls into kind of two main areas. The first of all is to see that the uptake has happened and that it's working, and I think we've ticked the box in both of those things. So with that in place, it's the classic PDSA, as I said earlier on, Plan, Do, See, Act, and then review. So we are finding that, first of all, thankfully in this country we've had a huge uptake. We find that the vaccine is providing that flood wall against significant sickness and indeed hospitalization. So that's great. And then from there, the boosters seem to be the next logical choice. Would it have been something factored into the financial? Probably to a certain degree. However, it is that refinement of the program all the way through. So, and again, just to echo what you've said there, which is a really good question. So, for example, the vaccination center I work in Nina, we're shutting on different days of the week, depending on availability for walk-ins, so that we are cutting costs, so we don't have that massive outlay 7 days a week that we had, say, 6 weeks ago. Now we're 3 or 4 days a week, and it's meeting the demand that's there. So the beauty of any really good financial plan, of course, is being able to top and tail as you go through, to nip and tuck it as you go along, so that you're not needlessly spending money that doesn't need to be spent. And I think the same applies with regard to the booster vaccine rollout as well.
Great. And just a final one, sorry, from me, just in terms of a lot of the vaccines here, you know, weren't used, and I think we had to expedite them to other countries. Would you have any insight into that, like in terms of government? How did they decide where they were going to go? You know, have you any insight into that process?
My understanding is that is very much, as you say, developing on shelf life. I understand certainly from a European viewpoint, because that's really where all our vaccine was decided upon, that there's a European level to that. So we got some, as you know, Romanian AstraZeneca in, and I think there may have been a counterpart shuffle over and back from there as well. I think it's very much on a need basis. So logistically, who needs it most? Are they the closest to it, and what's the shelf life for a vaccine? They're the three principles involved. And then it's a European decision, obviously, as we sit in the European Union Council. So that's my understanding of how it works anyway.
Great. Okay. Thank you so much, Paul.
You're welcome.
Have we any questions from any of our attendees? We're delighted to hear them.
I'd also be glad to hear from any other vaccinators, by the way.
Oh, yes, of course.
To see if anybody else has any jabs. And just on a side point, because obviously my background is general dental practice, so it took me quite a while to get my hands around using a very small little injection syringe as against the big housing that I'm normally used to using for local anesthetic. I would say one other thing, and this is set aside from the finance thing, is the level of camaraderie and esprit de corps and spirit that we had as a team working together from very disparate healthcare backgrounds was great. And it is something that I know Sarah would chime in with this as well. One of the great things that we learn from our courses here at RCSI is this idea of diverse healthcare backgrounds. So for example, last year I was supervising CNM1s, pharmacists, doctors, and one other dentist as well. And that idea of that shared healthcare viewpoint, albeit from different angles, is so important and enriching. It's the peer-to-peer learning, even online, which is so informative and helps to kind of round out a lot of our views on many aspects of healthcare.
Absolutely. And, you know, the sharing of knowledge is so important now, you know, particularly across the different countries and the way countries are dealing with the pandemic, you know, from South America all the way over to Australia and whatnot. So never has there been a more important time for sharing knowledge. So look, thank you so much for that, Paul. Really informative discussion and great insight into the vaccination program and the whole operational production pipeline, you know, even down from the swabs right down to the IT. I mean, you would forget how much is involved. So excellent presentation. Thank you so much. And we'll just move on here now, and I will just speak to you all very quickly about our application process. As you may know, we have 3 master's programs within the Graduate School of Healthcare Management, Leadership and Innovation in Healthcare. We also have a Healthcare Management Master's, which Paul delivers on, and we also have Equality and Safety in Healthcare Management. Those are 3 of our master's programs, which and the applications for these programs are actually closing quite soon. So if you are interested in applying, we have a team of recruitment agents who are able and ready to speak to you if you have any questions, and you can contact us at leadership@rcsi.com. So we'll be there to answer any questions you may have. So the application process, we also have a video about this, which we can send you, which will bring you through from the beginning to end of the application process. But again, just reach out to us and we're more than happy to help you with any questions or queries you may have. We also have 3 professional diploma programs which are running throughout the year. These are featuring, they start in the autumn, but we also have a spring intake as well. So we have professional diploma in clinical leadership, in human resource and performance management in healthcare, and also in leading and quality and value improvement. And again, the applications for these will be closing in October. We are here to answer any questions that you may have, and we can set up a one-to-one call if you would like some more information. So thank you all for today. I will take any questions on the application process if there are any. So I'll just give it a minute. Okay, we have Turkey. I hope I'm spelling that right. Hello, how are you? Would you like to turn on your camera? Can you hear me? Have you a question? Hang on. Just see. Hi.
Hi, good afternoon.
Can you?
Yeah, I can
Yes,
hear you. Can you hear me?
I can, yeah, go on ahead.
Yeah, my question is regarding the emails keep coming to register for specific masters. From my understanding, I have already registered. So how can I figure it out? Yeah.
I will make contact with you after the webinar, Turkey, and
Okay.
we can look into it then. Okay.
Thank you.
Thank you so much. Have we any more questions? And I'm also joined here by my lovely colleague, Franco, who's in Dubai.
Thank
Hello,
you very
Franco.
much,
How are
Amy.
you?
All
Are
good.
you well?
Thanks for asking. How are you?
Franco is great. Franco does overtime, helps us.
Cool.
These
By the way,
webinars,
Turkey,
so
yes,
delighted
we'll,
to see you.
yeah, just to go back on there, Turkey, don't worry, we'll actually update our your profile in the system, but rest assured, your profile is set, okay, and then we'll be sending your credentials, or you might have already received your credentials right now, okay, and then I'll get in touch with you soon.
Great. Thanks so much, Franco. Have we any more questions from anyone? No, I don't think so. Okay, thanks. Okay, folks, as I mentioned at the start of the webinar, this webinar will be recorded, so we will send you out the webinar within the next couple of days. We have a very exciting webinar also coming up, which will be the final of our webinar series for the summer. And that's featuring one of our alumni, Martin Dunn, who is former director of the National Ambulance Service. So Martin will be here to give us an insight into how his team managed the response unit for the pandemic in Ireland. And that will be the National Ambulance Service within Ireland. But Martin has also helped to implement training programs for other ambulance services across the world and the Middle East. So we're delighted to have him. And that will be September the 20th at 3:30 Irish time, and that's 6:30 p.m. Dubai time. You will be receiving an invitation for that shortly. So stay tuned for more details. So once again, I just want to take this opportunity to thank Paul O'Dwyer so much for today's webinar. So insightful, so many great findings. We were delighted to have you on board with such a topical program and such topical information and a real rockstar resource to have for these webinars. And I know, as you said, Paul, so many of these financial management tips are so helpful, particularly for the masters in healthcare management and even in clinical leadership and leading in quality and value improvement. I think vaccination program is a great project to look at from not just a budget perspective, but also from a quality perspective as well. So lots of learning come from that. So thank you so much. And of course, thank you so much, Sarah McDonald, for joining us today for the introduction. We'll leave it there, folks. As I mentioned, myself and Franco will be here, and Miriam and the team to help you with any questions that you have regarding the applications for our upcoming master's program, and get those in soon because the closing date for these applications is coming up in the next few weeks. So if you have any questions regarding any of our master's programs, please contact us at leadership@rcsi.com. We'll leave it there for today, folks. Thank you so much for coming. Lovely to see you all, and stay tuned for the details of our next webinar. Thank you very much. Bye-bye.